The legislation before us reflects this subcommittee's efforts to improve public health outcomes, enhance patient access, and modernize our healthcare delivery system to better meet the challenges Americans face. These bills represent thoughtful efforts from members on both sides of the aisle. Several of the bills before us focus on reauthorizing critical public health programs that support early detection and prevention that expire at the end of the fiscal year. Marking up these reauthorizations gives us the ability to continue to support these initiatives while also allowing us the opportunity to examine ways we can strengthen these programs. This includes H.R. 4348, the Kay Hagan Tick Act reauthorization, which supports and enhances programs for tick-borne disease research, prevention, and interagency coordination. We will also consider H.R. 4541, the Breast Cancer Education and Awareness Requires Learning Young Act, or the EARLY Act, which supports breast cancer detection and education for young and high-risk women. Additionally, we will mark up the Accelerating Access and Dementia and Alzheimer's Provider Act, or the ADAPT Act reauthorization, which seeks to improve care through provider tools and training initiatives. I also want to highlight H.R. 8205, the Accelerating Access to Critical Therapies for ALS Act, which is before us this afternoon. Last month, I had the privilege of speaking with the founders of IMALS, Brian Wallach and Sandra Abrevia, and participating alongside them in a press conference held by Representative Quigley, who has done great work on this issue. Their testimony before the subcommittee was both moving and insightful, and I especially want to recognize that they had driven all the way from Chicago to be at our hearing and advocate for this important program to support those with ALS. We will also consider H.R. 5160, the Stem Cell Therapeutic and Research Reauthorization Act, which extends and funds national programs that facilitate bone marrow and cord blood transplants for patients with blood cancers and other fatal diseases. In addition, we are marking up H.R. 8209 legislation to reauthorize school-based health centers, which aim to strengthen school-based health services and mental health access for students. We also have a couple of FDA reform bills before us today, one of which is H.R. 2715, the Destruction of Hazardous Imports Act, which gives the FDA the authority to destroy imported products that pose a significant public health concern. The other is H.R. 2021, the FDA Modernization 3.0 Act, which directs the FDA to fully implement policies established under FDA Modernization 2.0 to reduce unnecessary animal testing for drug development. Lastly, we will mark up two bills from our Medicare patient access hearing earlier this year. H.R. 1703, the Choices for Increased Mobility Act, works to expand access to titanium and carbon fiber wheelchairs for Medicare beneficiaries, while H.R. 5347, the Healthcare Efficiency Through Flexibility Act, aims to improve healthcare reporting for accountable care organizations. I am encouraged by the collaborative work that has gone into the legislation before us today, and I want to thank all the members and staff who worked to bring these bills to the subcommittee. I look forward to continuing to work on these policies and bringing them to the full committee, and I'm eager for a productive markup this afternoon.